So I went to a conference this week. It was the American Association for the History of Medicine's spring meeting, and so it was pretty exciting. I was able to meet one of my old mentors from Columbia. He let me know that he was coming to Buffalo, and for some reason their conference was in Buffalo. It was really cool. Got to go to a lot of interesting talks. Got to meet a lot of very interesting people. Medical history is kind of in that. Similar to public health in some ways, but in many other ways it's not really. So there were some things that I was like tangentially related in, because a lot of the research I do is about historical consequences of previous policy, but they really are really into history, so they're really impressive people. But the other thing I got to do, become a postdoc, I got books. So I got books for free. So I'm just going to go through. Now, this first one wasn't free. It was just something that really caught my eye. A Thirst for Wine and War, The Intoxication of French Soldiers on the Western Front by Adam Zientek. So super cool sounding book. My wife is French. My family is French. They are currently over in France right now as we are speaking. But basically this book is about World War I, and talks about how French rationed wine for their soldiers, and it went from a small rationing at the start of the war to basically they were drugging their own soldiers to make them fight by the end, and at least that's what it looks like from the back cover here. So I'm really excited to read this. I think it's super cool, the style too. I think you can tell that this book was really well loved and really well thought of as far as an academic textbook, because usually they do not look like this. So an academic book that looks like this, super excited to read. A book I got for free, which I am very excited about, is The Public Health Approach, Population Thinking from the Black Death to COVID-19. It's by Alfredo Morabia. He was the most recent editor of the American Journal of Public Health, so the official journal of the American Public Health Association, one of the associations I belong to. Really cool, really excited to see this. I worked on COVID-19 policies and procedures and emergency operations when I was working at the Centers for Disease Control, as well as with the county, state of Arizona as well. So a lot of my research and understanding of what really happened there comes from experiencing that, working through it, and so really applying those lessons to other lessons I learned about policy and implementing it in the future. So really excited to see what's actually in here. Again, it's an academic text. It's an academic book. Academic books, you can kind of usually tell, one, because while they're a little bit chunky, they also usually are not that long, quite frankly. So, for example, there are 215 pages here. The final page of this book is right here. So it's about 150 pages. This is all the footnotes, acknowledgments, other things, citations that are in here. And that's why I really like reading academic books, because they are sourced. They are academic. What you see in here is it might not be as, thoroughly peer-reviewed as a scientific article, but they are peer reviewed. They are reviewed and edited, and that's what's really exciting about them. So that's the second book. So I got policy interest on French wine, soldiers, military wine, alcohol, drugs, as well as COVID-19. And the last book, reason I really started to go browse it to begin with, is this: Sovereign Bodies, Sovereign Spaces, Urban Indigenous Health Activism in the United States and Australia. It is by Maria John. Maria John's assistant professor of history at the University of Massachusetts, Boston. And it goes into kind of, I think the 20th century, 21st century, about urban indigenous healthcare and health statuses. I'm very interested in this type of stuff because I've only ever lived in cities. I would qualify myself as an urban indigenous person myself. And overall, the amount of research and the amount of thought put towards urban indigenous populations is a lot less than, say, the reservation-based. Not for no reason. The needs and interests and, the rights to, continuously support, the actual nations is, potentially, I would argue, more necessary than just urban populations. However, the vast majority of Indigenous peoples live in urban areas, and the health status outcomes and everything, and educational outcomes and everything, are similar across those levels. So we really want to see those types of things. And so this is what it goes into. Just from the actual, again, the reading of this book, it looks very interesting. Like I said, this book is like over 300 pages, but the epilogue is on 222, so you got over 80 pages of notes, of citations, of everything else. So very important. Again, you're reading something that's pretty high quality. It also talks about Urban Indian Health Institute, so always interested to see what they're talking about there. They're an epidemiology center, so they produce really good work, but also they're an epidemiology center. So I'm really interested to read this. I might be able to see how ways I can incorporate some of the chapters into my own writing. So pretty excited about that. So yeah, 3 great books from a history of medicine, of a medical history conference. So pretty excited about it. Woo!